we're all trained in our early careers to say yes. How do you build a practice? You say yes to everything. Even if you're a joint surgeon and you have a cubital tunnel come in and you're in private practice in rural Virginia, you're going to say yes to that because you know what? That might come attached to a total knee or a total hip replacement someday. You're going to be a generalist. You're going to do things like that help build your reputation, your notoriety, your quality, your referral base, whatever that is. I think true maturity, though, 5-7 years into practice, is when you start to begin to say no. You have the guts to have a real conversation with yourself. I don't need to be on that committee. What is that doing for me to get me to this level of the next step that I have, this vision? And just as importantly, a real conversation with a patient. If you are able to say no and live with yourself, that maturity, now you can start to really sit down, feel comfortable in your own skin, pull up a chair, and tell that patient, this is what I'm going to do. And I tell patients this all the time. When I tell them no, I will say, if you're a parent, I'll ask them, are you a parent? Generally, most of the time, patients will say, yes, I at least know the concept of parenting. And I will say, my job is to prevent you as a child from touching the hot stove, just like a parent does. That child wants so desperately to touch it because it's this curiosity and because they've been told no or for whatever reason. And I know it's going to create harm. And that's what I see this moment as being. And I'll have this conversation if I have another doctor sitting across from me. I'm not dumbing this down. I'm not patronizing them. I'm just trying to put a simple concept of saying, I've been down this road enough to know that if we keep pushing, you are going to either have a devastating outcome or I'm going to make a difficult situation even more miserable. And I want to protect you from that.